Let's talk about several different ways and how we can approach the treatment of strabismus. Now, strabismus is another form of lazy eye. It's when an eye doesn't point straight. It either crosses inward or outward or up or down, actually. Most commonly are the inward one, we call that esotropia, or the outward one, which we call the exotropia. So in strabismus, usually it's a breakdown of what we call binocularity. Binocularity is when the two eyes are working together as a team the way that they should be. If the eye starts wandering by crossing in or by drifting outwards, suddenly the two eyes aren't aligned anymore. They're not really working together the way that they should be. Only when the eyes are pointed in the straight ahead position are they truly working as a team. So here are 6 recommendations I have for approaching the treatment of strabismus. First of all, get the right prescription. So in some cases, an eye turn or an eye crossing can be related to the prescription. This is very common in a condition called accommodative esotropia. So if you have a little baby and you see that their eye's crossing in and you find, oh, they actually have a far-sighted prescription. You put on the glasses and their eyes straighten out right away. That's a positive response to what we call accommodative esotropia, meaning their eyes were trying to adjust to their lack of prescription, and when you gave them the right prescription, their eyes went to the right posture. Also, in other cases, such as in exotropia, when the eye goes outward, what if they're nearsighted and actually far away is a little bit blurry? Once you clear it up, they're able to focus on the right object, and now suddenly their eyes can go straight. Always make sure that if you catch any kind of eye crossing in or outward, you always make sure to get your prescription checked first. Tip number 2, always good to start with eye stretches. So we have 6 muscles that surround our eye that move our eyes in different directions. If we have an eye that is crossing inward or an eye that is drifting outwards, there's actually an opposite muscle that should pull it in the right direction. Just like stretching any muscle of your body, it's always a good idea to engage and stretch the muscles of your eyes as well. So you can look on our YouTube channel for some other ideas of how to do some eye stretches, but pretty much you want to try to engage these muscles because sometimes people don't realize that they have the capability to adjust the posture of their eyes just by engaging these muscles better. Tip number 3. Our main goal in the treatment of strabismus is always to aim for binocularity. Binocularity means that the two eyes are working together as properly as they can as a team. One of the best ways we can measure this is with this test. This is called stereopsis. So when you go to the eye doctor, your doctor may ask you to put on these cool 3D glasses, and they're going to ask you to look at this book, and they're going to say, what shapes do you see popping out, or do you see anything popping off the page? This is really important because if you can see things popping up, that would be an indication of depth perception. But more importantly, it's an indication of how well the eyes are working together. Let's say a patient doesn't see anything popping up, then that's usually an indication that one eye may be suppressing or turning off. Maybe they're only using one eye to see. That's going to really affect their judgment of depth perception and also even just how their eyes function in general, because two eyes really aren't working together. It's really just one eye doing all the work. The finer their depth perception is, the more in tune their binocular system is. So we always aim for the best level of stereopsis because that tells us that their binocular system is as strong as it can be. Number 4, vision therapy. One of my favorite things to do if we have a patient that has strabismus is to do vision therapy with them. When treating strabismus, we know that the eye that crosses oftentimes has lower function. That means that it may not track as well, it may not move as well, it probably doesn't focus as sharply as the other eye that's pointing straight. So in vision therapy, we're trying to use all these exercises to try to strengthen the functioning of the eye that's crossing and also to encourage the eyes to work together as a team, again called binocularity, but we're really working on engaging the two together so they work really fluidly to be able to see clearly, move quickly, have depth perception, do all the things that our eyes need to do in order to function in life. Number 5, surgery. So a lot of patients come to me asking for my opinion if surgery is needed for their child or for themselves for strabismus. I'm a parent too, and I understand your concern if another doctor had recommended surgery for your child. However, with surgery, here's my opinion on it. In some cases, it may be helpful to help position the eye into a straighter position. But in other cases, such as what we call an intermittent strabismus, that means the eye is only turning some of the time, but not all of the time, then in that case, it may be possible to treat it without surgery because it indicates that the patient has some level of control over the posture of their eyes. If we can improve their ability to gain control over it with things such as vision therapy, then surgery may not be needed. In surgery for strabismus, what they are doing is they will detach the muscle from the eye, turn the eye into a straighter position, and reattach the muscle. So you're giving the eye a better alignment. However, remember that eye alignment is not just a function of the muscle, it's also a function of the brain. So the brain needs to accept that new eye position and keep it there. Otherwise, the eye can drift after surgery is done because the brain is not locking it into the right spot. Again, going back to my point of treating for binocularity, right? It's all about the brain and the eyes working together as a team. If that's not happening, even if you try to do a surgery for the eye, it may not stick because the eyes and the brain are not working together. Lastly, I know that some doctors do prescribe patching for strabismus. Now, what's the concept of patching? Is that if the patient's seeing some double vision because the eye is turning, then the idea of patching is let's strengthen each eye by having them wear a patch part of the day. In my personal opinion, I don't like this treatment very much because I feel like it's not promoting binocularity. If you cover one eye with a patch, you're only making one eye work at a time, but you're never encouraging the eyes to work together. I know that in some cases, some patients have said that patching was helpful, but in my personal opinion, it's not the best treatment option that's really going to promote the eyes to work together as a team. Thanks for watching this video on learning about the different ways of how to treat strabismus. Again, if you or your child has strabismus, don't give up hope. There's a lot that can be done to help restore their vision and make their vision as strong as possible.